New COVID guidance from the American Academy of Pediatrics recommending that all children over the age of 2 wear masks when they go back to school, even if they are vaccinated. That suggestion comes despite CDC advice that vaccinated students do not need to wear masks. More than 4 million children have been infected during the pandemic, and there are fears that number could rise due to the Delta variant and looser COVID restrictions. President Biden's chief medical advisor, Dr. Anthony Fauci, joins us now with more. Dr. Fauci, good morning.
Good morning.
Let me start there with children. It's confusing guidance for parents, which to follow. What do you advise that parents do with their students when they go back to school?
Well, I think they should do what has been locally asked for, namely, if the local schools, the Academy of Pediatrics actually makes that recommendation that children should be wearing masks from 2 years old onward. That is, I would think, the extra step of caution. In general, that is a bit different from the CDC guidelines. But right now, the CDC is carefully looking at that, and hopefully we'll have some now concordance of the recommendations. But the reason for what the Academy did was because of the high degree of infection dynamics that we're seeing. If you look at the map of the country right now, there's an uptick in cases in virtually all the states in the United States. And for that reason, they want to go the extra mile to make sure that the children are protected in school.
And obviously, everybody wants to see children back in school. You know, there are diseases, obviously, where vaccinations are required, things like smallpox or mumps. Should the COVID vaccine be on a list like that that's required for children to be in school and have that vaccination?
That might actually occur. That is not the situation right now. But I could imagine as we get further into this and we see where we're going with this outbreak, whether or not it's going to be essentially with us for a considerable period of time, I would not be surprised. That is not a policy right now, so don't anyone get confused by what I'm saying. What I am saying is that I would not be surprised that in the future, this is something that would be seriously considered, depending upon how we handle the outbreak. If we completely crush this and it stays away and there's very little activity at all, which I hope happens, if right now that's not happening, but if it does happen, then I don't think you require that. But if we go into this year and the next year and we see we still have a problem with this, it very well might be required.
And you talk about that spread, especially with the Delta variant right now. Only about 50% of the country, a little less, are fully vaccinated. You are everywhere. There are vaccines everywhere. They're available. What else can the federal government do at this point to get more people vaccinated?
Well, what they're concentrating on is to try and get trusted messengers to get to people who are recalcitrant about getting vaccinated and try and explain to them the importance not only for their own health, but for that of their family and for the community in general. I mean, people like your family physician or clergy or respected members of society, whatever it takes, because you're absolutely right. This is untenable to have an outbreak of this type and to have, relatively speaking, even though a lot of people are vaccinated, a lot of people are not vaccinated. And those are the ones that are getting infected. In fact, there's this striking statistic that people should really pay attention to. 99.5% of all the deaths due to COVID-19 are among unvaccinated people. That's a striking statistic. So when people are unvaccinated and they look at that, hopefully they'll really take a look at that and say, wow, I mean, really, for my own safety and that of the community, it's very important to get vaccinated. Put all other things aside, ideological differences, political differences, and then just focus on what this really is. It's a public health issue, a very serious public health issue.
And as you said,
and that's the reason why people should seriously, yeah.
And I was going to say, as you said, numbers don't always tell the full story, but right there with that one, it certainly helps give perspective. Dr. Anthony Fauci, thank you for the time.